The TCGA and also our efforts in prostate cancer genomics have really started looking at a very static picture. So we took our cases and looked at them in really a way where we didn't have the clinical information, we didn't have the serial biopsies. And part of a Stand Up to Cancer effort that we have along with Memorial and other institutions really started looking at the context of these cancers in treatment and how they respond to disease. So we're learning a lot about the heterogeneity of disease and also the mutations of resistance. And I think this is really a very important part of the precision medicine program. Now, one of the things I thought that President Obama said that made me very happy was that a lot of the efforts are going to lead to research opportunities. Many of them will be dead ends, but I really like the concept that what we're doing is also very important to recognize as an opportunity for people in this room and other investigators to carefully analyze what we're seeing and try to figure out how do we do better. And just as the example, the serial biopsies that we're seeing in the course of treatment are revealing mutations that we no longer have any idea how to treat. And so that represents a tremendous challenge for our community. And so that, I think that's what we've learned in not only prostate, but also in the advanced cancer activity that we have at our institute. Probably the one other comment I think is very worthwhile mentioning is that we haven't done a great job in taking this complex molecular data and integrating it into the electronic medical records. So if we have a patient sitting with their physician, it's often the case that we don't have a complete view of what's been done to them. And obviously we'd hope we'd know about their x-rays and their blood sugar levels and so on. We often have incomplete information, and the clinician may in fact not even be able to interpret the data because it's of a complex nature that they may not have been trained in. So really, I think we're in a position where we're creating wonderful data. We need to find a way to harness it so that it's part of a patient's initial treatment, but then as we follow them and how it will inform perhaps the best way to move forward, whether it's immunotherapy or other targeted therapy. And I think that these are, I think, some of the important aspects that we're seeing in both prostate, but also in other advanced cancers.